How to manage OCD triggers in your daily life. Hi, I'm Dr. Menije, a licensed psychologist here at Embracing You Therapy. Living with obsessive compulsive disorder can be incredibly challenging, especially when everyday situations trigger intrusive thoughts and compulsive behaviors. In order to best determine how to manage OCD triggers in your daily life, you have to understand what they are, how they impact you, and the various methods you can use to maintain a level of management and get back to where you were before you were triggered. So exactly what do we mean by a trigger? Because OCD triggers can be any situation, any item, any thoughts, or environmental factors. They provoke an intrusive thought, an unwanted obsession, and an urge to engage in a compulsive behavior, also known as a ritual. Now, not all signs and symptoms of OCD are the same, but these triggers can vary widely from person to person. There are some common examples. So your OCD triggers might be contamination fears, they might be perfectionism, need to do things just right, order or symmetry. So number 2, make value-based decisions. Making value-based decision is a tool from ACT, Acceptance and Commitment Therapy, where when living with OCD, you want to focus on your values because OCD is all about your fears and worries and threats. And OCD often miscalculates threats and make you think things are more dangerous than they are. For example, you may think because of your OCD, going to a party is a threat because there could be contamination, there could be relationship OCD, sexual orientation OCD triggers. But making a value-based decision would be thinking about how much you value connection or dancing, and that there's so much importance to attending this event to live a value or purpose-driven life. So that's what making a value-based decision looks like. Number 3, practice exposure and response prevention, ERP. It would be great if you could go through life without ever having your OCD trigger, but that isn't going to be the case. And ERP is a type of cognitive behavioral therapy from CBT that involves gradually exposing yourself to your triggers while resisting the urge to perform compulsions, whether they are behavioral or mental compulsions. And over time, this process, engaging in ERP, helps reduce the impact that triggers have on you. So the more exposures you manage without your rituals, without your compulsions, the greater your skills will be. And this is why addressing even your least worrisome trigger is a good practice and a good place to start, even if you don't feel like it bothers you much at all. Triggers of all intensity and significance impact your nervous system the same way, only to varying degrees. So no trigger is too small to address and no trigger is too big to tackle. If you find this information helpful and you like more help in managing your OCD, please reach out to us and we'll be happy to connect with you. And if you have any questions, feel free to share them below and I will personally answer to them. Thank you so much, and I'll see you in the next episode.